good evening, everybody, and welcome to another edition of Ask the Doctor. Tonight, a functional medicine approach to diabetes. Be ready to take lots of notes. You know that we're going to have tons of information. So, the man of the hour teaches, trains, and lectures doctors all over the world. Has over 3 decades in clinical practice. Incredible family man. If you could take a look at this wonderful family in the picture. Great friend, mentor, the incredible Dr. Bob Rakowski.
Carol, thank you always for the beautiful intro. I have to say that this is both simultaneously one of my favorite and least favorite topics. Part of the reason it's my favorite is I've probably seen more diabetic miracles faster than maybe who knows what percentage of people all around. But I tell people my type 2 diabetics, most of them are non-diabetic in 60 days. So that is possible. And by the way, I saw 3 siblings from the same family a month ago, all diagnosed with insulin-dependent diabetes. But yet, in a matter of a few short weeks, we were able to get them off of insulin because their blood sugar improved so dramatically. So I actually think that the doctors misdiagnosed them as type 1 diabetic because plenty of their pancreas was functional. And with the right program, miracles can happen fast. And that foot below, that shows some of the major complications of diabetes, which is circulation problems, nervous system problems. So if the brain doesn't have a problem, the kidneys don't fail on you, and you don't go blind, you often have limbs amputated. And by the way, most diabetics are actually going to have a heart attack or stroke. So that's not a pleasant outcome. And my mentors taught me decades ago, friends don't let friends become diabetic. We want to prevent it. And then certainly if we do have it, we want to reverse it as fast as possible. When I was in school, they had what they called juvenile onset diabetes, which now they're calling type 1 because they thought the only way a kid would get diabetes was an autoimmune attack on their pancreas. And then they would call type 2 an adult onset diabetes. But guess what? Now the fastest growing demographic is actually children because our diet is so poor. People are so toxic. And kids are even born sick. And we want to really change that around. And then now they're even calling dementia a type 3 diabetes of the brain. So we're actually going to talk about type 1, type 2, and type 3. But it is the most expensive problem in the sick care system. We won't call it healthcare. We're looking at billions of dollars every single year. I'll show you the global numbers in a moment, something like 420 billion. But I was listening to a podcast yesterday, and there was a guy that used to be in the insurance business. And he said, you know what? US alone, diabetes is about $110 billion a year industry. He says, do you think these people sitting around these boardrooms want to find a cure for that? And do you erase this $110 billion in revenue? He said, not likely. A functional medicine approach is probably the way to go. To put the cost of diabetes in perspective, you could literally take stacks of $100 bills and they would actually stand up 605 miles. And that is the cost of diabetes in 2021 and going up every single year. 420 million people on the planet have diabetes. And guess what? Very preventable. As I was saying early on, people that have diabetes are much more likely to have heart disease and die of heart attack or stroke, and they do it at a much younger age. So we certainly don't want that to happen. Type 1 diabetes, the cells of the pancreas make insulin are essentially destroyed. Now, it could actually be a trauma, or it could be autoimmunity. And in the past, they even had a type of chemotherapy. The abbreviation was STZ. It stood for streptozotocin, and they stopped using it because as soon as they infused it, they would kill the cells of the pancreas that made insulin, and they give these poor cancer patients type 1 diabetes. So not a good idea. But what happens in type 2 is that the body just no longer responds to insulin. You abuse that system so much that you burn out the pancreas and the cells just say, enough of this already. We're not responding to insulin. Now, that's the one that we tend to turn around pretty fast within about 60 days. And then Alzheimer's, type 3 diabetes. And here's a fascinating statement about that. Many times this can actually be reversed. That is the Alzheimer's, the memory loss. And again, I listened to a fun podcast yesterday. The guy said, look, the memory isn't lost. It's just not accessible. And if we make insulin work better, if we make the brain work better, if we make the brain healthier, they can actually access these memories. You actually have to kill the cells of the hippocampus to create memory loss. Insulin is absolutely life critical. It is not just about getting sugar into the cell. It's also important for protein and fat and even minerals and other levels of nutrients. And so when people have diabetes, they waste away. A type 2 diabetic, they tend to get really obese. And then if they suddenly start losing weight, that's going to be a pretty bad thing for them because that means their body isn't responding at all. But this was a 1923 picture. This young lady would have died if not for the discovery of insulin. So we're grateful for that. We're grateful that she got insulin and hopefully had a much longer and hopefully healthier life. But now we know a whole lot more than we did before. So when you start looking at the bottom of this curve is hemoglobin A1C, and that represents your 120-day average of blood sugar. And when those numbers start going up, your risk of dying goes up 20x. So that's a lot. We certainly don't ever want to let people get that out of control. And then how about the complications? Blindness, kidney failure, nerve damage, amputation, heart disease. That includes heart attack and stroke and whole body loss of circulation. And I put these PubMeds in here for a fun reason. My favorite superfood on the planet, Ganoderma lucidum, is not only good for all the complications of diabetes, but it's also good to help prevent and or reverse diabetes. Wonderful for the pancreas, wonderful to microbiome of the gut, wonderful for every cell in our body and brain. This is a picture of Jay Cutler. He was a pretty famous NFL quarterback, very talented. Age 24, he suddenly started losing a ton of weight, 35 pounds in a very short period of time. Went to the doctor and he realized, holy cow, I've got type 1 diabetes. Not very common for a 24-year-old elite athlete, but it can happen. This is a TED Talk, and this was a pharmaceutical executive. And he says, look, here we have a picture of the pancreas. Here we have an abnormal cell that should make insulin. That's called a beta cell. And here we have a normal beta cell. And he says, here's the problem. The immune system kills these abnormal cells. And what he suggested is, you know what, they just need to figure out how to keep the immune system from killing abnormal cells. Let me tell you the problem with that. Every one of us, statistically, I should say 99.9% of us, sorry, there's a very tiny percentage that don't make between 500 and 1,000 cancer cells every single day. If you keep the immune system from killing abnormal cells, what happens? People get cancer. So there's absolutely got to be a better strategy. And when we start talking about the autoimmune debate, medicine says, oh, it's killing your cells. It shouldn't be doing that. And what we realize is that the immune system is actually killing either sick, intoxicated, or injured or infected cells. And therefore, it's actually doing its job. So our goal is to get the body healthy, to get rid of what's actually causing the problem. But in the meantime, these are proven nutrients that can balance the immune system no matter what the imbalance. So if you have autoimmunity, it can calm it down. If you have a weak immune system, it can pick it up. And that means it make you more effective against cancer and or infection. By the way, it can also calm down allergy. And this is the magic thing about it. What if you had someone that had cancer, infection, autoimmunity, and allergies? Yeah, the natural model says, we'll give you God's pharmacy and the balance will magically happen. No drug can even come close to replicating that. So when people have obesity, they have a much higher risk of all kinds of serious autoimmune circumstances. They have a higher risk of cancer, and they certainly have a higher risk of type 1 diabetes. And most people, I will put on, at least for a short period of time, a gluten-free and dairy-free diet. Now, why is this needed today? It turns out that the vast majority of gluten is genetically modified, something that humans have never been exposed to. And when they genetically modify the gluten, they think they have a full permission slip to spray as many herbicides, insecticides, fungicides around because it doesn't kill these genetically modified grains. So they're toxic, they're malnourished, they're foreign proteins. And what about dairy? Milk is allowed to contain residues of over 80 different antibiotics. And when people consume cow milk, they actually get some cow insulin, which is very similar to human insulin, only very slightly different. And they suggest that could actually trigger an attack on human insulin. When we start looking at stress opposes the action of insulin, and therefore we want to buffer the stress to help insulin work better. And a fascinating study that came out a few years ago, they realized that if someone has a significant enough stressor to actually cause post-traumatic stress disorder, 146% more likely to develop a single autoimmunity and 229% more likely to actually develop multiple autoimmune circumstances. When we start looking at how do we break the stress pattern, melatonin, theanine, Ganoderma spores every waking hour, or if you've seen my Zooms with Camilla Hiller, she actually combined the melatonin, theanine, and other phenomenal nutrients in something she calls Dr. Bob's Stress Reset. I give a big shout out to Camilla every single day. She actually had a gastric bypass surgery that created severe malnutrition, and she credited the stress reset with literally saving her life. And you know what? That might be accurate because she was really going downhill fast. And when she combined the melatonin and theanine, actually hired a very good nutrition company to do that. The way that they could blend it together was by adding MCT oils, other adaptogens, some good forms of B12. And she literally created a better product for a better outcome. And by the way, I'm having a Zoom with her Thursday afternoon, 1 o'clock Central, to share her story and more about the stress reset. When we start looking at type 1 diabetes and why it's going up and why all this autoimmunity is going up, it certainly cannot be related to changes in genetics. The environment is profoundly different. It's much more intoxicated. It's far more malnourished. And I'm going to make the statement that it's even more stressful because even lights that have blue hues, like all of these screens and even indoor room lighting, they all can be very stressful to the body. So people will often use the Roger Bannister story as, look, when someone does it, maybe way more people can do it. You look at Edmund Hillary, when he and Tensei Norgay climbed Mount Everest, that was an amazing feat. They were on top of the world and they gave each other absolute credit. They were the first to get up to the top and get back down safely. That's critical. But so many have done it since. And I often use this to say, hey, look, we've already turned around type 1 diabetes once. Why not do it again? Seems like it was about 6 or 7 years ago. I was on a plane. It was a long flight. I was sitting in first class and I happened to be sitting next to a guy and I asked him, what do you do? He actually says, I'm into organ regeneration. I said, all right, you're going to have to tell me about that. He says, look, we can take organs out of a pig. We can actually digest all of the genetic material out of it. And then we can infuse it with human stem cells. And we're finding that it's actually working. So it had gone through animal trial and they've tried it in humans. They haven't perfected it yet. They had their first transplant. The individual survived the surgery, but not much longer after that. So they still need to work out some of the kinks. But I think there's a good future in that. And on the list are the cells of the pancreas that make insulin. Some people are saying, look, if we can live another 10 or 15 years without a major medical problem, there could be advances that could significantly extend our longevity. And we would certainly like that. When it looks to the actual causes of diabetes, you've heard me talk about the deadly quartet of stress, toxins, malnutrition, physical inactivity. And we'll start with toxins. 25% of all problems on the planet. This was an article a few decades ago, and it was entitled Chemical Toxicity, a Hypothesis to Explain the Global Obesity Epidemic. And they said, look, as toxins have gone up, so has obesity. And by the way, obesity and diabetes go together. So they're now even calling it diabesity. And when you start looking at these obesogens, they have another term, or actually two other terms. One is metabolism disrupting chemicals, because they'll shut down cellular energy efficiency. They'll shut down thyroid efficiency. But they also call them endocrine disruptors because they disrupt the sex steroids as well. So when you start looking at these sources of obesogens, we likely, if we're not very diligent, are exposed every day, multiple times a day. And you might wonder, my gosh, I'm eating good, I'm exercising, I'm doing what I should. Why am I getting fat? You are being exposed to toxins that promote fat. And unless you are very specific about avoiding them and cleaning them out of your system with a good detox, you're going to be in trouble. You start looking at this term obesogen, first time 1999, so 24 years ago. Since then, 3,600 published medical citations. So there it was noticed, 1999. If you can actually see my cursor, then look, all of a sudden, every single year, a growing body of research. And I'm not surprised if you haven't heard of it yet. You might ask, why haven't I heard of this yet? you're not listening to the right people, right? A lot of the drugs out there, by the way, will also disrupt energy efficiency and metabolism and can accelerate fat gain. So we want to avoid those at all costs. A very simple quote: toxins always disrupt mitochondrial function. That is where fat burning occurs. That's where 94.4% of human energy is made. So I had the joy of co-lecturing with these two amazing ladies, doctors, brainiacs, great humans. Dr. Judy Mikovits, if you've actually seen the movie Plandemic, you'll see her. She was the main character. She actually went to jail for turning in the Anthony Fauci for killing AIDS patients with AZT. They had plenty of data that what they were treating them with was actually going to accelerate their death. So take a look at that. Actually do a little research and figure out where's this coming from, right? And how in the world could we ever let this slide? And Dr. Tracy, and in their co-lecture, they said something that I thought was absolutely genius. Don't count calories, count chemicals. Calories are not anywhere near the problem unless you're getting all junk food as the chemicals that we are being exposed to. And then you look at the graph of diabetes and this toxicity, and you can see we could even maybe create a new term, diabetogens, instead of obesogens, because they're doing that too. GT, that is a toxic marker within the blood. It stands for gamma glutamyl transferase. It's how the body gets glutamine in the cell to make glutathione, the predominant intracellular detoxification agent. And as toxin exposure goes up, GT goes up, and hemoglobin A1C, or the marker of diabetes, also goes up. The symptoms of chronic poisoning include fatigue, sleep disturbance, intestinal distress, allergy symptoms, headaches, confusion, and anxiety. I've said for years, if you get rid of those symptoms, I would probably have to do something else for a living. And that is what people are coming in with. So I give them a good detox as one of my top starting points. And as I tell people, bodies respond to frequency, duration, intensity, quality, and timing of stimuli. So I will often dose things every waking hour. It's important to know that a water fast is not going to give you the nutrients, the energy, or the protein you need for a detox. So you will likely break down. And there's a seeker, I'll call him a seeker. He's a medical doctor named Peter Attia. I read his most recent book, which was called Outlive. I listened to his podcast. He's got a good heart and he's got a good brain. He's just medically trained. And so he has a little expanding to do, but he's moving in the right direction. He used to do consistent water fasts. Then he realized, you know what? Those aren't so good. I start breaking down lean tissue and I have a hard time getting it back. Good clue there. Water fast, not the best for you. I recommend 7 to 10 days, twice a year, with intense detox, nutrients, and organic vegetables. As we get into malnutrition, 2020 malnutrition was the leading cause of death on planet Earth. The more processed the food, the more likely it is to spike your blood sugar and lead to diabetes. By the way, we might also throw in it's more likely to be full of chemicals too. Metformin is the world's top drug for diabetes. But the nice thing is that our favorite superfood, Ganoderma lucidum, works by the exact same mechanism. Metformin has a failure rate after about 5 years, but it also has hundreds, literally hundreds of side effects. And what about Ganoderma? Hundreds of side benefits. So what choice would you make? And the failure rate of metformin, 21% at 5 years. What could they do? They just add another drug to the mix, and maybe another drug, and then maybe insulin. And by the way, never once did you get better. And keep in mind, how long are my diabetic patients diabetic? On the average, less than 60 days. So why would they need a drug for 5 years? There are serious problems with type 2 diabetes, including the progression of fatty liver, which can ultimately lead to cirrhosis and ultimately to liver cancer. So we don't want that to happen. The more processed the diet, the more you'll spike insulin, the more you'll gain fat. The less processed the diet, the better for insulin, the better for fat loss. And how wonderful that our favorite superfood, Ganoderma, actually protects against insulin resistance. I saw Diana Schwartzbein at a conference in Southern California about 20 years ago. Her book was recommended, and I'll tell you what, I never would have bought it on the title, The Schwartzbein Principle. What does that mean? She might have changed the subtitle later, The Truth About Losing Weight, Being Healthy and Feeling Younger. I think maybe a title that would have sold was Eat Your Way to a Sexy Body and Enjoy Every Bite, because remember, people buy titles. But very simply, she said, why do we have so much diabetes? Guess what? There's 5 hormones that will elevate blood sugar. That would be all the stress hormones, glucagon and growth hormone. There's only one that lowers it. So 5 against 1, you're going to have a hard time winning. By the way, a podcast that I listened to yesterday, Eric Worre interviewed Grant Cardone's longevity expert. And he says, you know what? When I was working in life insurance, if I wanted to teach people how to get diabetes, I would send them to the American Diabetic Association website and say, here, eat the diet they recommend. You're guaranteed to get diabetes. So you might wonder, how could there be such a disconnect between health? Well, they don't study health, right? They just simply don't. So Diana Schwartzbein said something interesting in her book. She said, my engineers in Southern California were testing their blood sugar after every meal. And they said, look, Dr. Schwartzbein, when I eat according to the American Diabetic Association's guidelines, my diabetes gets worse. But when they ate keto paleo, guess what? Their diabetes would mostly go away. So this progression of bad blood sugar, that's literally what dysglycemia means, bad blood sugar in the blood. The way that it goes is first insulin levels will rise first after a meal, and then they stay risen. Second, body fat rises. You can't store fat without insulin. Third, blood fat rises. And then fourth, glucose rises. So if you're looking at blood sugar, you're missing all of your early indicators. And simple fact, you cannot store fat without insulin. 90% of type 2 diabetics are overweight or obese. And interestingly enough, they've now redefined obesity in Asians. Obesity in non-Asians is a body mass index of 30 or above. Obesity in Asians, they're calling it 26 and above. Why? Because they have a propensity to store more visceral fat and become diabetic faster, even though their body may look leaner. So my memory aid for paleo keto, leans, greens, nuts, and seeds. And I like this memory aid. If it's white, keep it out of sight. The exceptions would be things like jicama and cauliflower. But besides that, white usually means processed foods. And then all of my dietary guidelines in one statement: eat real food, clean food, not too much, not too often, every color, every day, in a way that honors your physiology, your genetics, and your body goals, mostly plants. Michael Pollan, in his book, In Defense of Food, said something strange started happening in the US in 70s and 80s. He said food started flying off the shelves of grocery stores and being replaced by food-like substances. It looked like food, it smelled like food, it even tastes like food, but it wasn't food. It was basically chemicals. And remember, count chemicals, not calories. And that's part of where the obesity pandemic actually took off. When people have type 2 diabetes, if they do intense physical exercise, they can dramatically reduce their blood sugar, because within our muscles are something called exercise responsive GLUT4 vesicles. The harder muscles contract, the more of these vesicles will go to the surface of the cell and drive sugar into the cell independent of insulin. This is a graph of actually power over the course of time. The more powerfully you contract your muscles, the more glucose you will drive into the cells. And finally, type 3 diabetes, called dementia. There are so many families that suffer so horrifically because they have a family member that doesn't yet qualify for other types of care. So around the clock, they have to take care of these family members. And these numbers are just growing and growing. And it's just horrible. We need to stop this. So I was co-lecturing at a conference with Dr. Bredesen about 8 years ago, before he completed his book, The End of Alzheimer's. But he brought up some very interesting cases. He says, look, we're already beginning to reverse dementia. I think probably, to be politically correct, he said the first program to reverse cognitive decline, prevent and or reverse cognitive decline. You know, if he talked about dementia or Alzheimer's, who knows, the regulators would get after him. But basically, he has hundreds, and now I'm sure many thousands of cases that they reversed. But his whole teaching point was, whenever there's a problem with a tissue or organ in the body, there are 3 distinct zones of cells. There are cells that are dead. Nothing we can do about that. There's cells that are fine. There's nothing we need to do about that. But in between our cells that are functional but not functioning, if we can get back function, we get just back that function. So I tell people, if this foot picture on the left date, the first day I saw this patient, if that were a brain, this person might not remember their own name, their spouse's name, their kid's name. By 2 weeks later, maybe they forgot some details of their childhood or some things that were nowhere near as significant. And then here, they had fully functional memory, maybe just lost some details of the past. So is it possible? Yeah, it's proven now that it absolutely is. Dr. Bredesen shared his slides with me. This is one of his slides. He talked about the way medicine treats diabetes is they say, okay, we've got a roof that has 36 holes in it. The list of 36 on the right, those are all dementia risk factors. He says medicine clogs the biggest hole and says, there you go, you're better. And he says, I realized that wasn't right. A lot of people are realizing that isn't right. And that's why the medical management of dementia is beyond horrible. But he says all of these 36 factors fall into three categories: toxic, inflammatory process, and a decline in growth factor. And guess what? All those things can improve with healthy living. So the deadly quartet goes into dementia as well. Mike Webster was featured in the movie Concussion. There he was in his playing days. There he was, his character in the movie, who actually died homeless under a bridge, not even knowing his own name. On autopsy, they came up with a diagnosis called chronic traumatic encephalopathy. That is what CTE stands for. And this is what your brain should look like. And this is what Mike Webster's brain looked like. It was absolutely choked off by amyloid plaque. So if you look at the picture on the left, this was a study where they actually gave mice or rats, I guess it was mice, a very severe concussion. And each group got a concussion. One group got Ganoderma and other support nutrients. The other group got nothing. The group that got nothing at 21 days when they sacrificed the animals and autopsied the brain, this is what they found, all this amyloid scar tissue. The Ganoderma group, about 95% reduction. We also know that high levels of cortisol is associated with shrinkage of something called the hippocampus. That is the memory center. So high chronic stress is bad for your brain, body, immune system, and memory. And we also now are knowing that metals and biotoxins, and that could be things from bacteria, mold, or viruses, can also contribute to Alzheimer's. So we want to clear the toxins, kill the infections, enhance the immune system, control the inflammatory process, stay young or revitalize youthfulness by good living. And certainly malnutrition is a huge factor in Alzheimer's as well as other problems. And you know what they give them in hospitals likely perpetuates malnutrition rather than reversing it. And finally, when you're physically active, you dramatically reduce the probability of Alzheimer's, nearly a 50% reduction, 49% reduction in seniors that are most active versus those who are least active. And then Donna Mae, one of my favorite stories, right after this case happened with Maureen, I was giving a health lecture. It was a health lecture that was partly about diabetes, partly about Ganoderma. And I shared this foot, and one of the women in the audience said, oh my gosh, my friend's mother has severe dementia. She's in a wheelchair because they've already amputated one limb. She's got a wound on the other leg that's not healing. They say they're going to take that leg if it doesn't heal. Do you think this will help? My answer is always the same. I don't know if it'll help, but it sure won't hurt. Just with some Ganoderma irradiation-infused red tea and some capsules of spores every day, the wound on the foot completely healed. And amazingly, at 3 months, the doctors declared that both her dementia was in remission and her diabetes was in remission. Fun case to wrap up with before we start answering questions. Does anybody have any questions about anything at all?
Yes, we actually do have a few questions that came in as well beforehand. So you would speak about your 60 days to remove people from things like metformin. Could you give us a little idea of what that protocol would be and how we would contact you if they wanted to do that protocol?
Sure. The way to contact me, my website, thedrbob.com, thedrbob.com, set up a consult. But here's what I'll tell you. We're going to do a stress reset. We're going to do a detox. We're going to do a keto paleo diet. We might also add in some other blood sugar friendly nutrients like chromium and vanadium and lipoic acid and carnitine and sometimes resveratrol, those last three, especially for people that have neuropathy. I would much rather treat a diabetic before these long-term complications set in. And even my extreme cases, I can think of one person that came in and I would call him a profoundly advanced type 2. They started out as a type 2 diabetic. They didn't take care of themselves. They started using insulin. They still didn't take care of themselves. And they came in with blood sugars running over 700 with a good dose of multiple diabetic drugs and insulin. And now that one, it took us a year to completely undo. This person completely recovered, got off of all medication and insulin, and still has a healthy, wonderful existence. But that one took a while. My average diabetic patient, 60 days or less.
That's amazing. We have a question in the chat. Do you know anything about geographic tongue? And if so, what would you recommend for a child who has all the symptoms?
It's a B vitamin deficiency. Just look that one up. It's classic. And it looks like a map on the tongue. You should spit out the tongue. And it should be smooth, and it should some papilla, and it shouldn't have any weird colors, and it shouldn't have these weird ridges, but they have like divots all over their tongue. And it's a classic B vitamin deficiency. And it might be B3. I've got to go back in my old notes, but here's what I'll tell you. I don't give one B vitamin. I don't give B1 without 2 or 3. And keep in mind, they go all the way up to B17, maybe even higher. But what are the essential ones for humanity? B1, B2, B3, B5, B6, B12. And you might say, wait a minute, whatever happened to B4 and B5? They actually found out that those aren't life critical to humans. Humans can actually make them. Same with B7, B8. One of those is biotin, B10, B11, B13, 14, 15, 16, B17 is actually Laetrile, which if you actually go and look at like a documentary like The Truth on Cancer, they found out it has profound anti-cancer properties. Now, it's also amazing that the people that were promoting these natural cancer therapies, a lot of them disappeared. That's just an odd thing about our world. If you have something natural, wouldn't we want to shout it from the rooftops and help people? The nice thing is we're connected where people can get information if they really want it, even though you might ask yourself the question, has there been an effort to suppress information that might be good for human health? And if so, why? And what am I going to do about it? No matter what your answer, here's what I always encourage people to do. Take 100% ownership of your own health and do all that you can to optimize it. And I think that's pretty good advice, no matter who you are.
Excellent. How would you improve eye health or vision?
That's one of the major complications of diabetes. They actually call it diabetic retinopathy. So, the first thing we want to do is figure out what's causing the problem. So if it's diabetes, we want to optimally control the sugar. Now, something else can happen, glaucoma, which is increased eyeball pressure. And I've seen eyeball pressure patients where we actually reduce it in a visit with cranial manipulation. And it's pretty interesting that one of the original tests for cranial manipulation, you actually just push on the eyeballs. This doesn't hurt, or it shouldn't hurt. But if one eyeball feels like, oh my gosh, that's really sensitive, then that is your indicator. And then you start manipulating the skull until that pressure is relieved. And we've even seen vision improve. Now, there's also something called macular degeneration, which is an age-related circumstance. And there's a couple bioflavonoids, more specifically lutein and zeaxanthin are the names of that. Zeaxanthin is actually with an X. There's something like 4,000 named bioflavonoids, and they are in brightly colored fruits and vegetables. So eat a bunch of those. Are going to be really good for you. But remember, prevention trumps cure. Ultimately, we want to figure out what's causing the problem and address that.
Okay, another question.
The answer, okay.
Yeah, that was my question that I asked about eye health and vision. So when I was younger, going to eye doctors and that, they said I have astigmatism in one eye. I don't really understand what astigmatism is. And then what is a way to improve the astigmatism from where overall eye health? And then with that being said too, is I notice when I'm looking around at different things, I feel like I see better out of my left eye than my right eye. So is there a way to where I could equal the amount of vision in both eyes because it feels like I'm looking out of my left eye more than my right eye.
People have a hand dominance and people actually have an eye dominance as well. So they don't necessarily have to be exactly the same. But basically, astigmatism is an alteration in the shape of the eye that is going to affect its ability to focus. And so in Ayurvedic medicine, they give eye exercises where they have you near focus, like I've got a cup that has words on it, and then a far focus. So I might look at that. And then I've got in the next room that I can see through open doors, I've got a motivational poster on the wall. So I might read my cup, I might read my poster, read my cup, read my poster. When people are constantly doing one focal length, their eye adapts to that. And the more you make your eye adapt to rapidly changing circumstances, the more you keep it young and better. So keep in mind, one thing I tell people, and full disclosure, I now have reading glasses. I'm approaching, it's actually, I will have completed my 6th decade. So approaching the 60 year. So 0 to 10 was the first decade. So getting ready to finish my 6th decade. A couple of years ago, I just realized, you know what? I'm better off with reading glasses rather than straining or trying to hold a distance. It's okay. I'm going to give in to that. But that doesn't keep me from occasionally doing my eye exercises and saying, can I prevent that? And now my magnification is 1.25. So it's not much, but I don't want it to get worse. And could I reverse it? Maybe to some degree. But at any rate, take care of what you have, your entire body, mind, and spirit. Remember, friends don't let friends become diabetics. So if you can make that go away, make it go away. Do your eye exercises, nourish your eyes. Don't ever intoxicate or stress your body, and you'll be better off for it.
Thank you.
You're welcome.
Next question. Lisa asks, why do diabetics have bigger belly fat?
Visceral fat is also known as angry fat. And by the way, regional fat distribution is under endocrine control. That is a direct quote from the medical literature. And ultimately, belly fat is cortisol fat. It's actually stress fat. So cortisol is what's known as a glucocorticoid. It actually helps the body make more sugar. So if you're not getting sugar into the cell, the body will release cortisol and say, hey, we need more sugar. We need more sugar. It'll actually break down lean tissue to free up amino acids to convert to sugar. But since you're not using that sugar to fight or flee, then your body says, oh, I don't need that. I'll store it as fat. And if cortisol is high, it becomes belly fat. And by the way, we'll talk about 2 different types of belly fat. There's going to be visceral fat, which is considered the most dangerous fat. It's called angry fat. Now that they have DEXA scans, believe it or not, they don't even want you to have more than a pound of visceral fat because your body will become progressively inflamed and it's a path of decline. If you're getting belly fat, time to do something different. Remember, don't count calories, count chemicals. Don't be ingesting any chemicals.
Perfect. One other question. Neuropathy, is it only related to diabetes?
Now, there's also toxic neuropathy. I see plenty of people that have gone through cancer care and chemotherapy, and they come out and their hands and feet are really struggling. And then there's the old idiopathic. They don't know what caused it. So I would happen to think that's some toxin unknown or undiscovered yet type of neuropathy. But my strategy is always similar. Do a complete assessment, figure out what's not right with that patient, optimize as much as you possibly can. And I've even seen idiopathic neuropathy resolve.
Excellent. And Lisa just asked a quick question. Does insulin have an effect on fat?
Oh, of course. Yeah, you can't store fat without insulin. So think of that picture of that little girl in 1923 wasting away to the point of dying. And then when she got insulin, then she put on an appropriate amount of body fat for whatever she was, a 7 or 8 year old girl.
Perfect. Looks like you're good.
All right. So I'm thinking about doing something next week. I really enjoyed Eric Worre's podcast where he interviewed Grant Cardone's longevity expert. And this guy spent 20 years in life insurance, pretty fascinating guy. And he said he could look at people's lab data and the medications they were taking. And by the way, every single time someone was taking a medication, it was a huge knock against their life insurance premium. So if you weren't healthy and you required medication, they knew you were going to die early and they just start counting the meds and then your life is going to be shortened. And by the way, he said something fascinating. And, you know, this study's been around for a long time, but in 2018, Johns Hopkins did a study where they literally called medicine the number 3 cause of death in America, killing over 250,000 people a year. So he finally said, after he watched so many people and he'd predict when they were going to die and they went ahead and died, he said, I can't take this anymore. I'm going to start sharing information. So he's trying to get people off their drugs, eating better, exercising more, managing their stress. And he has a series of longevity franchises. And I found them profoundly insightful, but don't take my word on that. Go see Eric Worre's interview. It might have been his very first podcast with Grant Cardone's longevity expert. I think it's Ed Dowd. Ed is first name Dowd, D-O-W-D. So pay attention to that and be 100% proactive about your wellness. So with that said, good night and God bless. I hope to see you next week. Enjoy an epic, amazing, wonderful week of contribution.